Hello, everybody. Today's topic, we're going to be discussing clinical exercise physiology for cancer, cardiovascular disease, and pulmonary rehabilitation. And essentially, when we think about what clinical exercise physiology entails, our job is to help to manage chronic conditions with lifestyle and behavior changes. And again, think about how many chronic conditions there are out there that can be positively affected by evidence-based physical activity. So essentially, when we think about what's happening in a clinical setting as it relates to exercise physiology, we are essentially personal training individuals with disease and using exercise as a tool for treatment of the disease in order for us to help these people to return to a good quality of life, right? Because again, it's not enough to just want to live a long time. We want to live a long time and also have good quality of life, right? So again, the idea here is how can we use exercise as sort of this tool to help us to achieve that goal? So when we think about exercise physiology in the clinical setting, like what does this entail? So essentially to kind of give you a little bit of an idea about this career and kind of what happens within this career. Okay, so my degree and also Dr. T's degrees are in exercise physiology. And there's really only a few things that you can do with those degrees. One is work in a clinical setting. And again, that's something that Dr. T did for a long time before joining us at Loris. So he is absolutely the expert in this area. But again, a lot of my like classmates, for example, would go on to work in a clinical setting. So again, that's a really common career path based on our backgrounds. Again, I would, if you do have specific questions and this is something that's like super interesting to you, I would encourage you to reach out to Dr. T and talk to him a little bit more about it because he's actually worked in this field. This is not an area that I've worked within this realm. Again, my expertise is more sport performance and sort of the metabolic application of exercise. So a little out of my wheelhouse, but again, I can give you sort of the nitty gritties here and a nice kind of intro to sort of what this career looks like and what this branch of exercise physiology looks like. So when we think about exercise physiology from a clinical perspective, again, we know that consistent physical activity plays an increasingly important role in prevention of disease, rehab, and adjunctive therapy related to many different disorders. Okay, so again, I've listed here some of the clinical areas that we could work in and some of the common diseases or conditions that we might experience within that particular clinical realm. Okay, so cardiovascular disease, again, think ischemia, chronic heart failure, or congenital heart disease. In the pulmonary clinical area, we could be working with COPD, cystic fibrosis, asthma. Those are all common conditions that we would work with. Neuromuscular area, again, stroke, MS, Parkinson's disease, Alzheimer's, cerebral palsy. Again, we might be working in conjunction with a physical therapist, for example, or an occupational therapist when working with these diseases in that particular type of clinical region. When we look at metabolic immunology, hematologic diseases, think obesity, diabetes, renal disease, menstrual dysfunction, and some of the issues related to fertility, cancer, and allergies. Certainly a wide net there that we're casting. And then when we think about orthopedic disorders and aging, think osteoporosis, osteoarthritis, and then sport-related injuries. Think torn labrum or ACL repair, things like that. And again, when we think about a lot of those orthopedic conditions, those are going to be conditions that are really commonly, seen by physical therapists. So again, we might work in conjunction with a physical therapist in order to sort of oversee a treatment plan. So again, a lot of collaboration here is certainly possible. And then when we think about cognitive and emotional disorders, anxiety, stress, depression, how can we use exercise as a tool to in conjunction with other types of therapy, help people to kind of overcome those conditions? So what's the link between sport medicine and exercise physiology? Okay, so sport medicine is going to relate to scientific and medical aspects of physical activity, physical fitness, health, and sports performance. And this can encompass both home and work. Okay, so again, when we think about, what does this look like? Carefully prescribing physical activity can contribute to our overall good health and quality of life. So again, you can sort of think about sport medicine, I think, as a way to help our athletes overcome and rehab injuries. However, when you think about it in sort of a more broad context, think more than just sport performance. Think home life and activities of daily living, and can I do the tasks that I need to do my job. So again, we can think about this application in a little bit of a different light. So sport medicine, again, I think gets this rap for really only working with athletes, and we want to get them back to as strong as they can be and as fast as they can be and back to their full potential and all of those types of things. But it can certainly be more than that, right? So we can think about this as it relates to, helping someone return to their activities of daily living following diagnosis and things like that. So again, think Dr. T's lab, right? So again, we're working with cancer patients to help them overcome their chemo, radiation, all their treatments, and how can we help them to return to their activities of daily living? Again, that would certainly fall under this context, right? But again, some of them have never done anything athletic. So again, think about how we might be able to apply this information and apply prescribed exercise or physical activity to improve health for anyone, right? Based on any of these conditions. So how did this how did this type of career come to be? So we think about the development of clinical exercise physiology. We first began to use physical activity in disease recovery in the 19th century, and cardiac rehab programs were first developed in the 1950s. Again, before the 1950s, they weren't really needed because cardiovascular disease wasn't super common. And now, as we sort of see trends within our country, this is becoming one of the major diseases that we are struggling with, and one of the major conditions that we must overcome in order for us to continue to live, right? So again, we think about causes of death in our country, cardiovascular disease is a huge one. So 1950s, again, think about the huge spike we've seen and prevalence of cardiovascular disease and the need for cardiac rehab programs based on the development in healthcare as well. So not only are people experiencing more cardiovascular disease in our country like today, we're also seeing more individuals that can survive from heart attacks and from different episodes that way. And so the need for cardiac rehabilitation is really been increasing from the 1950s on. So the American Heart Association and the American College of Sports Medicine developed testing and training procedures for healthy and diseased individuals. So again, we're sort of establishing and continuing to modify guidelines to help these individuals return to their activities of daily living. And again, also in the late 1950s, we started pulmonary rehab programs. Again, think about smoking and how cool that was so long ago, and the effects of that and how that's sort of continuing to affect people that are older now. So we think about pulmonary rehab as it relates to like COPD, for example, and how that's pretty prevalent in the smoking population. What can we do to help those individuals to be able to live normal lives and be able to complete their activities of daily living? So when we think about the duties and responsibilities of someone that works in this clinical realm, okay, so they're going to do a slew of different things. So every day is sort of different, and they might do a couple of these things. They might do everything within one particular day or one particular week. It really depends on the structure of the facility, the structure of the organization. So their duties include conducting pre-exercise screening, performing exercise testing and evaluation, developing exercise prescriptions for these individuals, instructing individuals on proper training techniques. So think that application of like the personal training type of thing, and then supervising exercise programs in various settings. So again, if I have a bunch of clients or patients on the bike, I need to be watching and making sure everything's going well for them within that particular mode. So when we think about some of these jobs that are going to be associated in clinical exercise physiology, one of the major duties was exercise testing and evaluation. And this is used to clear individuals for safe participation in physical activity and exercise. And it can also serve as sort of a starting point or a baseline for developing exercise prescriptions. So again, monitoring their current capacity as it relates to intensity and duration of exercise will allow us to kind of have a starting point, right? Again, a lot of the individuals that we're going to be working with in this particular field are going to be very deconditioned. So maybe they can only make it 3 minutes on the bike or 5 minutes on the treadmill or something along those lines. So again, it allows us to set things up from a progressive overload perspective so that we can safely move our clients forward. We can also use exercise testing as a diagnostic tool. And so this will help us to assess the presence of cardiovascular and pulmonary disease. And we can do these exercise tests with EKG, with a metabolic cart. We could be looking at heart rate. We could be looking at blood pressure. So again, there's lots of variables that we might look at kind of based on the individual and based on the protocols that have been established with that particular healthcare facility. Additionally, we can look at functional capacity, and this will help assess an individual's capacity to participate in physical activity and exercise. So again, if we can kind of understand where their peak is or what their maximal capacity is, then again, we can understand what they are capable of achieving throughout the exercise program. Again, from a progressive overload perspective, that's super important in terms of setting our patients up for success in our program. So again, when we think about exercise testing and evaluation from a diagnostic perspective, a lot of times we'll be doing what's called a stress test. And a stress test is essentially when we hook up our participant to an EKG. So you can see here the different leads that are connected to this particular individual. And we're going to have them exercise. It looks like this guy is on a bike. And so essentially they're going to do a graded exercise test. And our goal here is to look for the point at which the stress of exercise could potentially induce some sort of abnormality or some sort of cardiovascular event, right? So again, when we think about EKG, essentially what we're looking at is the electrical movement through the heart. And again, while somebody might look normal at rest, once we provide them with stress, that's when things can kind of go awry. And so, we're going to use an exercise test, a graded exercise protocol in order for us to see if and when one of those conditions might arise. So what do we need to do sort of pre-test in order to prepare our patients or our subjects? Okay, so pre-test procedures, we're going to complete a pre-test screening for health risk. And again, we're actually going to talk about that in our next unit in class, talking about how to sort of classify individuals based on their health risks. We should do a physical examination. And again, that would be completed by your MD or your physician. We want to know their health history and we want an informed consent. So again, when we do these exercise tests and evaluations, we want to certainly be in good collaboration with the physician and other healthcare providers to understand limitations and health status sort of heading into the testing. So when we perform the test, again, we want to look at heart rate, blood pressure. We want to ask them about their RPE or ratings of perceived exertion. We can do an EKG or electrocardiogram. And again, that's what I mentioned before. That's where the electrodes are kind of hooked up around the heart. And it allows us to understand what's happening within the cardiovascular system from an electrical perspective. So again, it allows us to understand the signals that are being sent to the heart in order for the heart to contract in its very sequenced and purposeful ways in order for us to allow blood flow to occur in a unidirectional manner. Okay, we can also do an echocardiogram as well. And the echo is going to allow us to understand what's going on with the heart structures. So it's going to allow us to understand like what is actually happening with the blood. So it allows us to sort of see the movement of the blood versus with the EKG or the electrocardiogram, we're simply looking at the electrical activity within the heart. The echo is going to kind of tell us the results of that movement, right? So it's going to tell us what happens to blood flow. So it's going to allow us to really understand what's happening as it relates to movement within the heart. And again, I might do one or the other or both, depending on the diagnosis and really what's going on with our patient. Okay. We could also look at oxygen consumption and functional capacity. And again, we could use the metabolic cart in order for us to get oxygen consumption and understand what's going on there. Functional capacity would be like if we did the Bruce treadmill protocol or that cycle ergometer test where we take this person to maximal or a percentage of maximal heart rate in order for us to sort of understand where their maximal or functional capacity might be. So again, when we think about assessments that could be done, again, you can choose any sort of slew of these items. And I would say most common when we do stress testing, we're going to have the EKGs hooked up, which you can see here. And again, this particular gentleman is riding a bike. So it's going to be an incremental test. Again, usually 3 minutes in duration per stage for this particular test. Here's our clinical exercise physiologist over here, and essentially he's monitoring the EKG readout. So again, we'll get that sort of in real time, the same way we were able to look at your VO2 and RER in real time when you did your VO2 max test on the treadmill. So we're able to kind of analyze that as you go. And so he's able to sort of analyze this information as we go and look for indications of problems essentially, or use it as a diagnostic tool to understand, okay, well, once we got you to this heart rate, here's what sort of happened with the electrical patterns. So that's sort of what he's doing. He's sort of monitoring and analyzing in real time. This particular person over here could be a nurse. She could also be a clinical exercise physiologist, not exactly sure, but essentially she's going to be measuring blood pressure every 3 minutes throughout the test as well. And again, looking for abnormalities there in terms of blood pressure changes. And she is going to maybe report that back over to this dude, and he's going to record that information as we sort of go. The other thing that's kind of interesting about this, and again, I would say the bike is more common when we do an EKG, because in order for us to get an accurate reading with these electrodes, it's got to, like when it jiggles, like if you were to run or walk, we don't get as clear of readings. And so when we do like a bike, again, now he's just using his legs. And so it stays a little bit more stable. You get a little bit clearer reading in my personal opinion. But again, I would say it's more common for us to see people do this on the bike. Again, also note that the types of people that are doing stress tests generally, again, very generalization here, are going to be pretty deconditioned. They have cardiovascular disease or they have symptoms of cardiovascular disease. And again, a lot of that is very highly linked to poor diet, lack of exercise. So again, think very deconditioned people most of the time. And so we're going to monitor them pretty darn closely. Again, probably 2 people will be in the room at minimum when we're doing this type of testing. Okay, so when we perform the test, again, we can do a submaximal graded test or a maximal graded exercise test. Again, that would be sort of the job of that clinical exercise physiologist to determine what's appropriate based on the health history of the individual, and also based on sort of how that test is progressing. So if we get to, 80% of max heart rate and we're starting to see some things that we don't necessarily want to see in that EKG, then it's time to stop the test. So we won't necessarily take them to maximum, depending on what it is that we see sort of in real time as we're sort of collecting that data. Again, it might be useful to take them to maximal, depending on the person, depending on those results that we're getting sort of in real time. So it really just depends on that particular individual. The other thing that's kind of crazy to think about is when you're working with super deconditioned individuals, it's easy for them to get to max because their max is not very high. So it doesn't take a whole lot of movement or exercise in order for them to get to max. So even if you didn't necessarily intend for them to get to max, it's pretty easy for them to get to max, or it's pretty quick, I should say, for them to get to max because they're so darn deconditioned and they haven't done anything strenuous in years and years. So again, we can sort of select which of these options is appropriate based on how the test is progressing. So when we think about how do we apply this information, right? So again, I want to take a look at some of the clinical applications. So what are the populations that are going to benefit in a clinical setting from an exercise physiology specialist? Okay, so oncology or cancer represents a group of diseases collectively characterized by uncontrolled growth of abnormal cells. Again, there's so many different types of cancers and different presentations of cancers as well. Approximately 75% of our cancer survivors report extreme fatigue during and following radiation and chemotherapy. Different options for cancer treatments, and again, the diversity in terms of how cancer presents itself and what the treatments are is pretty darn vast. But it could involve a surgery, for example, breast cancer, for example, we would probably do a mastectomy where we just remove that particular tissue. So it certainly depends on, it really depends on where that cancer presents itself. Radiation, chemotherapy as well. Okay, so when we think about cancer rehabilitation and physical activity, the overall goal here of the healthcare team is to rehab the patient to a level of function that allows them to return to work in pursuit of normal recreational activities. So again, think about the types of people that are affected by cancer. We're looking at kids, middle-aged adults, older adults, whoever it is. How do we get them back to the life that they were living pre-cancer is essentially what we want to achieve here. And again, this is exactly what Dr. T does in his lab, is sort of working with patients in terms of helping them to return to their activities of daily living once they're in remission from cancer. Let's see. So maintaining or regaining functional capacity is what our goal is post-cancer. As of 2008, cancer was the #1 cause of death in our country, with 1 out of 3 people having cancer or experiencing cancer. Okay, cancer fatality is decreasing. So again, as our research and healthcare continues to improve, we're able to survive cancer. So again, when we think about the application from a exercise physiology perspective, our jobs are becoming more important because we're having more people survive cancer. We've also seen in the research that moderate intensity exercise improves immune response, which can help with cancer treatment and post-treatment. So we actually know that by doing exercise while you're going through radiation and chemotherapy, it actually improves the response of that treatment for this particular individual, which is really kind of it's really a tricky thing if you think about, like, and again, you could think about this in terms of pregnancy too. You feel like shit, but if you get out there and can do something, you're actually going to feel better and enhance your results of the treatment. So it's like, okay, I know you feel like shit and you feel like worse than your normal self, but you got to get out and do something in order to have the best chance of making your treatments effective. So kind of a tough thing, certainly from a psychological perspective, in terms of convincing people to do something even when you don't feel good, right? So I think that's also a huge obstacle when we work in a clinical setting, when working with cancer patients. Type 2 diabetes is another common condition that we would work with. And we know that the relationship between type 2 diabetes and GLUT4, if you remember back to our conversations from our metabolism units. So essentially, type 2 diabetes is when I have insulin, but insulin is not responsive or the cells are not responsive to insulin. So I'm producing enough insulin. However, my cells are not responding to the insulin. And so therefore, it's very difficult for us to get the sugars into the cell. And so essentially what we can do when we have type 2 diabetes is sort of upregulate the GLUT4 mechanism. And GLUT4 is a door that's going to allow sugars into the cell that's independent of the insulin response. Okay, so if I were to do exercise as a type 2 diabetic, I will be able to increase the number of GLUT4 doors that I have, or GLUT4 transporters that I have, and therefore increase my glucose uptake into the cells. Okay. I can also improve the sensitivity of my GLUT4 transporters, or my GLUT4 doors, to glucose with regular exercise. Okay, and we see this both in strength training and aerobic fitness. And if I were to do a strength training exercise bout, the effects can last for up to 72 hours. So that's freaking cool. We don't need to even exercise every single day. Maybe we could do every other day or even every third day in order to sort of maximize this GLUT4 situation and allow us to sort of begin to return our glucose metabolism back to normal levels. Okay. Weight loss reduces intramuscular fat, and this is responsible for reduced insulin sensitivity as well. So in addition to its effects on GLUT4 and on that particular pathway, we're also seeing an improvement in insulin sensitivity with GLUT1 as well. So it's a double whammy here in terms of the benefits that we see when we exercise for type 2 diabetics. Okay. Orthopedic conditions. So here you can see osteoporosis and arthritis affecting lots of people. And so when we think about these orthopedic conditions, again, this is certainly something that we could work with physical therapists on as well in terms of, what feels good. But this is kind of interesting and crazy to think about. But like, actually, you would think like if you have arthritis, like, oh, you need to rest the joint or whatever. But research actually shows that exercise can actually reduce symptoms of arthritis as we improve blood flow and improve range of motion to these particular joints. So again, kind of similar to cancer, like even though maybe it hurts and it's not comfortable when you first start, it's actually going to help your symptoms in the long run. So it's a great opportunity for us to sort of improve symptoms for individuals that have arthritis. And again, if you have really bad arthritis in your knees, I'm not saying we're going to get out there and go for a run, but maybe we get them in the pool and we can do some sort of therapy there. Maybe we can get them on a bike or have them do some of these other exercises that are non-weight bearing, but allow us to move through a range of motion. We think about osteoporosis. This is an easy one. So again, if you remember back to how sort of the bones and the muscles interact, if this is my bone and this is you can see my drawing skills here. This is my muscle connected to the bone. And essentially, when the muscle contracts, it pulls on the bone, right? That's how movement occurs. And the more I pull against this bone, the more I activate in this particular area the osteoblasts. And our osteoblasts are bone builders. And so the more stimulation I have of that muscle as it pulls against the bone, the more stimulation I will have of those osteoblasts, which allows me to build that bone stronger. So again, tons of reasons why people with orthopedic conditions should exercise and should be on an exercise plan. Cardiovascular disease, again, I would say this is the most common. I would say in a clinical setting, about 80% of the participants or 80% of your patients are going to be cardiovascular disease. So again, before initiating an exercise intervention, healthcare professionals must complete a health screening so that we understand their risk and understand what's safe for them. Should they be doing moderate, low intensity or high intensity exercise sort of based on their health history, based on their current health status. Okay, so again, stress testing can be part of this health evaluation so that we understand like, hey, we don't want them to go above 80% because that can be problematic because they have high blood pressure or whatever the situation is. So again, it's really important that we understand sort of their health background as we start to give them exercise prescription. But again, cardiovascular disease, I would say this is your number one participant. And again, a lot of these people have multiple conditions, right? I could have coronary heart disease and arthritis, or I could have coronary heart disease and cancer. So again, it's very common to have multiple conditions coming in at the same time. Again, think the majority of our participants, or the majority of the patients that we're working with, are deconditioned, they're unhealthy, and they're old. Okay, so again, they have a lot of conditions because they've spent a long time, or a large percentage of their lives, not eating healthy, living a sedentary lifestyle, and not managing stress. So again, the longer you live, sort of the more that compiles, and the more that takes a toll on the physiological function of the body. So again, we think about stress testing. Again, this is going to be really common for those cardiovascular patients. And what are we doing? Like, what are the purposes of this particular type of testing? So number one, we want to diagnose heart disease and screen for silent coronary disease in seemingly healthy adults. We want to assess exercise-related chest symptoms. So maybe I've been having shortness of breath or pain when I walk up the stairs. Okay, well, let's take a look at that and understand what's happening there. Number three, we want to screen candidates for entry into preventative and cardiac rehabilitation programs. So again, maybe this is somebody that has just had a episode like a heart attack or something along those lines. We want to screen them so that we sort of know where we should start them from an exercise progression perspective. We want to, number four, uncover abnormal blood pressure responses. So again, in that image I showed you of the stress test, we had either a nurse or a clinical exercise physiologist taking blood pressure every 3 minutes and looking at those responses and making sure that makes sense. Number five, monitoring effectiveness of therapeutic interventions, whether that be some sort of medication, maybe it's surgical, or maybe they've made some nutritional changes and we want to see how that's allowing them to improve heart disease conditions or cardiovascular functioning. And number six, we want to quantify aerobic capacity to evaluate its deviation from our normal standards. So again, if here's sort of my standard for 70 to 75-year-olds, where do you fall and how do we move you so that we can get you closer to whatever we consider as normal or within that normal range? Pulmonary rehab, I would say, is maybe, I don't know, 15% of the population that you might work with in a clinical setting. And the major goals from a pulmonary rehab perspective include improving health status, improving respiratory symptoms, including shortness of breath and coughing, decreased frequency and severity of respiratory problems, and maximizing O2 saturation, as well as enhancing daily functional capacity. So again, we think of like COPD, cystic fibrosis, for example, we can improve their symptoms through regular exercise. So COPD is one that is, I would say, most of the time caused from chronic smoking. You can have COPD without having smoked, particularly if you've been exposed to secondhand smoke. And again, I think we're sort of, as a society, moving away from smoking in that regard. And so we're seeing a decrease we will eventually see a decrease in this. Certainly our older population now, smoking was very popular during their youth. And so, they've certainly been exposed to that. And again, smoking in restaurants in Iowa was still a thing up until about, gosh, I was in high school and people were still smoking in restaurants. So within the past 20 years, people were still smoking in restaurants and things like that. So you were exposed to this in public settings very, very often. So again, I think some of those things we're starting to move away from, but we still have sort of a delayed response with some of our older populations in those regards. Cystic fibrosis, we're looking at sort of this mucus filling within the alveoli. And so it's a genetic condition. And so essentially with exercise, it can help to kind of get the movement and get that fluid kind of out of there. So that can be an effective way for those individuals to kind of push their lifespan out just a little bit as well. So lots of benefits when we think about this. Really, from any perspective, right? I think that's the one thing that I love so much about exercise is like, it helps all of us and it can help you in so many different ways, right? So when we think about disease and how we can use exercise as a tool to help us sort of treat the disease, but also how can we use it to develop kids? How can we use it to enhance longevity and quality of life in our later years, right? There's so many different great things about it. It's just a matter of how can you take that and how can you apply that to whoever it is that you're going to work with. So again, I just want you to really be exposed to all of the different sort of facets that exercise can positively impact. And again, this clinical setting is just one more really important area where we can take exercise and help to improve somebody's life with regular, consistent training. So anyway, that is it for today. I hope you have a great day, and we will see you next time.